MORTON'S NEUROMA is a neuromusculoskeletal condition. Look at this picture shows that X-ray findings. Look at this to rule out fractures or arthritis. Ultrasound detect nerve thickening. Look at this. Then MRI. It's provide detailed imaging, confirm the presence of neuroma. A detail going on. Introduction. Morton's neuroma is a painful condition that affects the ball of the foot, most commonly between the third and fourth toes. It is caused by thickening of the tissue around one of the nerves, leading to the toes, resulting in pain. Burning sensations and numbness. This condition is more common in middle-aged adults and women who frequently wear tight or high-heeled shoes. A definition: Morton's neuroma is a benign but painful enlargement of the interdigital nerve, often due to chronic irritation, pressure, or repetitive trauma. It is also known as interdigital neuroma, interdigital nerve fibrosis, or perineural fibrosis. Etymology. Morton's neuroma is named after Thomas George Morton, an American surgeon who described the condition in the 19th century. The term neuroma comes from the Greek words neuro, nerve, and oma, tumor or swelling, referring to the thickening of nerve tissue. Types. Morton's neuroma is typically classified based on its location and severity. 1. Classic Morton neuroma occurs between the third and fourth metatarsal heads. 2. Less common variants. Neuromas may also develop between the second and third toes. 3. Recurrent neuroma occurs when a surgically removed neuroma regrows. Causes: 1. Chronic pressure on the foot. 2. Wearing tight or high-heeled shoes. 3. Foot deformities. Example: bunions, flat feet, hammer toes. 4. Repetitive trauma from high impact activities such as running. 5. Abnormal foot biomechanics leading to nerve compression. Risk factors: 1. Gender, more common in women due to footwear choices. 2. Age, middle-aged adults are at high risk. 3. High impact sports, running, tennis, or sports requiring tight footwear. 4. Footwear, narrow or high heeled shoes. 5. Pre existing foot determinants, flat feet, hammer toes. Complications: 1. Chronic pain, discomfort. 2. Goit abnormalities. 3. Permanent nerve damage if untreated. 4. Difficulty in walking and performing daily activities. 5. Psychological distress due to prolonged pain. Pathophysiology: Morton's neuroma develops due to repetitive mechanical irritation, leading to thickening and fibrosis of the digital nerve. The thickened nerve becomes compressed between the metatarsal heads, causing pain and inflammation over time. Perineural fibrosis, endoneural edema, and demyelination can lead to permanent nerve dysfunction. Step-by-step pathophysiology of Morton's neuroma. 1. Chronic mechanical stress or irritation. 2. Perineural fibrosis or nerve thickening. 3. Edema and demyelination. 4. Neuropathic pain and entrapment. The fibrotic swollen nerve becomes trapped between the metatarsal heads and the deep transverse metatarsal ligament. This causes shooting, burning, or tingling pain in the forefeet and toes, worsened by weight bearing activities. 4. Formation of pseudotumor neuroma. The repeated cycle of injury, inflammation, and scarring result in a benign nerve thickening called a neuroma. The enlarged nerve become even more sensitive, leading to chronic pain, numbness, and discomfort in the affected toes. This process ultimately leads to the characteristic symptoms of MORTON'S neuroma, including sharp forefoot pain, numbness, and pepli in the shoe sensation. Signs and symptoms: 1. Sharp burning pain in the ball of the foot. 2. Tingling or numbness in the toes. 3. Feeling of a pebble or lump in the shoe. 4. Pain that worsen with walking, standing, or wearing tight shoes. 5. Temporary relief when removing footwear or massaging the foot. Medical diagnosis: 1. Clinical examination, checking for tenderness between the toes and performing the Meldor's sign test. Palpitation of a clicking sensation when sequencing the foot. B. Imaging studies: 1. X-ray to rule out fractures or arthritis. 2. Ultrasound can detect nerve thickening. 3. MRI provides detailed imaging to confirm the presence of neuroma. C. Electrodiagnostic testing, rarely used but can assess nerve dysfunction. Nursing diagnosis: 1. Acute pain related to nerve compression. 2. Impaired physical mobility due to foot pain. 3. Risk for injury due to altered gait. 4. Anxiety related to chronic pain and limited mobility. 5. Knowledge deficit regarding conditions and management. Medical management: A. Conservative treatment. 1. Rest and activity modification. 2. Use of wider shoes. 3. Orthotic devices with metatarsal pads. 4. Ice therapy for pain relief. 5. Non-steroidal anti-inflammatory drugs. B. Interventional therapy: 1. Corticosteroid injections for pain relief. 2. Alcohol or radiofrequency ablation to reduce nerve irritation. C. Surgical treatment: neurectomy, surgical removal of the neuroma. 2. Decompression surgery relieves pressure on the affected nerve. Nursing management. 1. Educating patients on proper footwear selection. 2. Encouraging non-pharmacological pain management, example ice elevation. 3. Assessing and monitoring pain levels regularly. 4. Teaching patients about post-surgical care if surgery is performed. 5. Encouraging adherence to physical therapy and rehabilitation exercises. Treatment options. 1. Conservative measures, shoes modifications, orthotics, ice therapy. 2. Medications, NSAIDs, corticosteroid injections. 3. Physical therapy, stretching exercises, foot massage. 4. Minimally invasive procedures, alcohol injections, cryotherapy. 5. Surgical management, neurectomy, decompression surgery. Psychosocial medicine. 1. Pain coping strategies, teaching relaxation techniques such as deep breathing and mindfulness. 2. Support groups, connecting with others who have similar conditions. 3. Cognitive behavioral therapy, CBT, helping patients manage chronic pain, anxiety. 4. Lifestyle modification, encouraging low impact activities such as swimming. 5. Patient education, empowering individuals to make informed decisions about their care. Prevention. 1. Wearing properly fitting shoes with wide toe box. 2. Using arc sports or metatarsal pads. 3. Avoiding high heels and narrow shoes. 4. Performing foot exercises to maintain strength and flexibility. 5. Seeking early treatment for foot pain or deformities. In conclusion, Morton's neuroma is a common yet painful foot condition that can significantly affect mobility and quality of life. Early diagnosis and intervention, including conservative treatment, lifestyle modifications, and if necessary, surgical management, can help prevent complications. Thank you. Have a nice day.